Good morning, everyone. Thank you for hanging in there. The technology is finally where it needs to be, and hope that it stays that way. My name is Ed Eilert. I'm chairman of the board of Johnson County Commission, and I want to say a big thank you to members who have agreed, community members who have agreed to work and serve on our task force. At the start, I think it would be a good opportunity for us to introduce ourselves and just a quick few seconds about your position, et cetera. And I'm going to ask Joe Connor, who's Assistant County Manager, to read the names. And after your name is read, give us that short, brief information about yourself.
Sure. Thank you, Chairman. So good morning, everyone. We'll start with Commissioner Brown.
Good morning, everyone. My name is Mike Brown. I'm a county commissioner. I represent the 6th District, the western half of our county. I serve as the vice chairman of the Board of County Commissioners, and it is a pleasure to be on the call with all of you. Thank you.
Thank you. Commissioner Hanslick.
Janae Hanslick, County Commissioner from District 4. I'm also the previous CEO of Safe Home, a $4 million nonprofit business here in Johnson County that provides services for victims of domestic violence and their children.
Okay, thank you, Commissioner. Scott Anderson.
Good morning. My name is Scott Anderson. I have a company called Riley Drive. In the last 15 years, I've owned and operated 20 plus restaurants. Currently own and operate 7 restaurants right now. Thanks.
Thank you, Scott. Tracy Osborne Olchin.
Good morning, everyone. I'm Tracy Osborne Olchin. I'm the president and CEO of the Overland Park Chamber of Commerce, and I'm representing all of the Johnson County chambers and their collective membership, and there are 9 of us in the county. And it's a pleasure to serve.
Thank you, Tracy. Frank Link from MARC.
Good morning. I'm the Director of Research Services at the Mid-America Regional Council, where my specialty is making economic forecasts. And I am busy working on forecasts for how this pandemic might play out economically for the region, sort of as we speak.
All right. Thank you, Frank. Eric Mickelson, or Mayor Mickelson, I should say.
Good morning, everyone. My name is Eric Michelson. I'm the mayor of the city of Prairie Village. I'm also a representative here of the mayors generally, who I'm reaching out to gather their input as well from the area. I'm a lawyer by profession and a partner owner of my law firm. I look forward to serving with you. Thank you.
Thank you, Mayor. Becky Yoakum.
Good morning. My name is Becky Yoakum. I'm the city manager for the city of Lenexa and also representing city managers across Johnson County generally, and we'll be reaching out to them throughout this process and look forward to serving with all of you. Thank you.
Thank you. Thank you. Julie Brewer.
Good morning. I'm Julie Brewer, the Executive Director of United Community Services of Johnson County. I am representing the nonprofit sector, most of which would be considered small businesses who have been deemed essential to the rapid response and will be even more essential to the recovery, and who are also grappling with changing employment and changing funding streams to do their work.
Thank you. Stan Holm.
Morning, everybody. I'm representing the healthcare sector. I'm the CEO of Olathe Health System. We're about a $370 million organization, so large business from that perspective with about 2,600 associates and providers as part of our system. I'll be in close contact with the other CEOs of the health systems throughout Johnson County through this process. I've already spoken to them. We speak as CEOs every single week, and I've already spoken to them about this task force. We'll do the same throughout this process. From the post-acute care setting, I will be in close contact with those individuals as well, and I've already spoken to some of them. And within Olathe Health System, we have 50-50 ownership and on our campus in Olathe for independent living, assisted living, memory care, and short-term acute care rehab. And then on our campus is Good Samaritan with their skilled nursing facility. And so there's one leader that we partner with over all of those on our campus, and also we partner with the other post-acute leaders as well.
Okay. Thank you, Stan. And Chief Troy Reddick.
Hi, everyone. Yeah, Troy Reddick. I'm the Chief of Police in the City of Leawood. I'm here representing the Johnson County Police Chiefs and Sheriffs Association, of which I am president this year. And I, of course, will be in contact with them through this process and getting their input as well. And it's a pleasure to serve.
Thank you, Chief.
All right. Well, thank you all very much. I should have introduced Joe. Joe is Assistant County Manager for Johnson County, comes to us from Wyandotte County, and he was Assistant Manager there in Wyandotte County and spent a little over 15 years prior to that as Public Health Director of Johnson County. So we're pleased to have his experience with us today through this process. Also, I want to introduce County Manager Penny Post Oak Ferguson, and Penny has been a couple of years now as our County Manager and has been involved all through this process. Also, I want to introduce Dr. Sami Arola, who is our Public Health Director, and the doctor has been with us for about 5 weeks. And has been in the middle of this from the day he walked into his office. He comes to us from Nashville, Tennessee, where he was Deputy Director of the Public Health Office. And also with us today will be Dan Robeson. Dan is the county's emergency manager, and we'll hear from those a little bit later. But first, I want to have the county manager say a few remarks, and then we'll go to Dr. Arola as well as Dan Robeson for some updates.
Bill, can you allow me to share? There you go. Okay.
Pulling up a slide here also. Thank you. Good morning. Thank you for serving on this committee. I do want to say that the 3 staff members that are listed as part of this committee are really ex officio. We are here for information. If there's voting happen, we won't be voting, so I just wanted to make that clear up front. What I'm showing you on the slide is the actions that have been taken related to declarations and orders, and the last one that's not on there is the most recent extension from the governor. But these are the list of items that we've been involved with for the county. So wanted to show you. I don't plan to go into detail with all of them, but you'll note that March 7th was the first positive case, and we had a kind of an emergency press conference that Saturday evening. And we knew this was coming. It was happening around the world and our country at that time. So it finally hit Johnson County then, and that's when many of us, leading up to that, and then at that point really started a higher level of communication and interaction. You can see the list of the others. The next one I would point out is towards the bottom is the March 22nd when Johnson County did the stay-at-home order, and then Governor Kelly did one after us. What's not listed here is the latest one that she extended through May 3rd. So with that, the county has not decided to take any different action at this point other than Governor Kelly. That discussion will be happening more in earnest probably this next week, since it's a week and a half away. So that's a summary of the actions that have been taken related to declarations and orders, and staff is here to help the process however you can, and if there's any research or information that you want us to pull, we can do that between meetings as well. Thank you. Dr. Arola, can you give us a summary of the testing activity that has occurred, the tests that we have, and what it looks like going forward as far as availability of the systems that we need?
Thank you, Chairman. Good morning, everyone. Sami Areola here. I'm the Director of the Department of Health and Environment. And like the Chairman said, I've been here for all of 5 weeks, but I'm looking forward to working with you. One of the things that we wanted to do very early in the process was ensure that we have data to understand what the virus is doing in our county, but also to be the basis of our decisions. A lot of what Penny just showed, those were very, very timely and they were appropriate. And I think that's why our data is kind of trending in a way that I personally like. Of course, we have a lot more testing to do. And so our testing plan has been designed around getting into what's going on in different sectors of our population. So we have testing going on for the general population. And I think for us, we started that very early. It's kind of unique. A lot of other places are trying to catch up to do that. But when this started, because we didn't have enough testing resources, the few resources that were available were shifted towards high-risk hospitalized population. But which is very good data, but we wanted to get a broader idea of what's going on. And so we have had drive-throughs where we've tested our general population, basically people that we have said stay at home, don't go to work. And we've tested that. The numbers have been very good. We also sent out a population survey for symptoms to our general population, also trying to achieve the same thing. And we had about 72,000 people respond, and about 1.5% says they might have symptoms consistent with COVID-19. Again, pretty good. But then the next bucket for us are essential services workers. Those are people that have been out there, people that are working in our nursing homes, hospices, and working as custodians, working in our drive-thrus, in the pharmacy, in our grocery stores. And we just started that last Friday. Again, very good news. We have, last Friday, we took a sample from 186 of people in those categories as the starting step. All 186 came back negative. And I'd said that that's really a very important population. Think about it, these are people that have been out there. And that included some of our first responders, people that work for our EMS fire, were part of that planning. Workers in our long-term care facilities were part of that. Some Johnson County employees were part of that. And to augment that first part, we are going to Walmart to go, and we have four teams that are going into Walmart tomorrow to go and test. We have similar commitment from Price Chopper and Hens House that we're going to go and test those groups, our grocery workers, and see what those numbers look like. Those will be very good indicator of what's going on in our community. And I mentioned our first responders to complement the groups that we are testing as part of this essential workers category. We also have an agreement where our first responders with St. Luke's, if they have any symptoms or have some measure of increased risk from exposure, they go and get tested. And again, the numbers there is also looking good. The third category for us is our long-term care facilities. That is really the biggest concern that we have now, not because exposure is high. As a matter of fact, our random sampling from 19 of those facilities with slightly over 100 samples, depending on their size total, have all come back negative. But in about 10 of those facilities, we have had introduction of the virus into those facilities. And once they go in, it becomes very, very tough to control. And even when you control them, they do damages pretty quickly because that's where we have a vulnerable population. I'll give an example. One of them is Lakeview. We had cases earlier in them with a group of people that play bridge together. They were quick to contain that. We haven't had any cases there in over 3 weeks, but within the short time that they were there, they did some damage. So that's where we're trying to build our the wall, we want to build it stronger so they're not introduced into those facilities. So we're conducting a survey in that category. And so if we do this, for most of this, we have a single data point. This coming Tuesday, we will do our second community testing drive-through. We plan to do that at least 3-4 times before we have enough confidence about the trend, but just confidence that we are making deductions based on data that truly represent what our conditions are. We're planning the second part of the essential drive-through also next week. And so if we do that 3-4 times in the next couple of weeks, 2 to 3 weeks, we should be very confident about where we're trending. And so that's, and in terms of testing supplies, that's been the biggest obstacle that we have. And as you begin this conversation, really follow, Joe is going to be talking about those, but these are premised very largely on having a sophisticated and robust surveillance system. And so ensuring that we have testing supplies to know the impact of changes whenever we start to roll things back, and whatever we decide to roll back, to know the impact quickly will depend on setting up a robust surveillance system. I will say that local farms have been very supportive. We got supplies from Olathe Medical Center. Thank you for that. We got some from KDHE. We are thankful. We are requesting more from them. Quest Diagnostics have been very helpful. And the past couple of days, through Joe Connor's effort, we're making tremendous progress with Viracor. We think in the next couple of days that we're going to get supplies from them. So I think we're looking good. And then the KU health system, through efforts of Chairman Eilert and Joe, we're making progress along those lines. So it is possible that we are okay and have enough supplies to do this first round of testing for you to be able to make a decision as to whether we're in the right place to move forward. But moving forward beyond that, in terms of testing supplies, there are challenges that still exist, and that's what we're going to keep working on. And I'll keep you informed as we go, and looking forward to opportunities. If you have opinions or connections that can assist us, we're definitely all ears to that. Thank you.
Okay, thank you, Dr. Commissioner Brown, did you have a question of the doctor?
I do, thank you. Dr. Areola, just a quick question, because it may have been my signal that cut out, but you said how many were tested positive in our frontline workers, the group that went through? What was the percentage or number?
It was zero. All 186 were negative, which is by far to be the biggest news, because these are people that have been out there. 0%.
I assume, doctor, that even surprised you.
That's really good.
Yes.
That's really good, yeah.
Thank you. Dan Robeson, one of the issues that similar to some of the testing supplies are the availability of personal protection equipment. And Dan, can you give us an update where we're at there?
Good morning. Yes, Dan Robeson with Johnson County Emergency Management. As was mentioned, the role of emergency management in this and in all events is to support the countywide response and recovery operations, and ensuring that our community's emergent needs are met, along with ensuring that we have a comprehensive recovery plan in place to allow the community to safely get back to normal, or to our new normal. Our County Emergency Operations Plan, or our Operations Center, was activated on March 7th, since we had our first case. And as was mentioned by the chairman, one of our primary focuses from the very beginning has been working to secure PPE, our personal protective equipment, for first responders and healthcare community. We've been securing some supplies from the state and the national strategic stockpile, and we've distributed that. Every week we receive hundreds of requests for resources, and we've been prioritizing that throughout the county. The Board of County Commissioners has recently approved a large purchase of PPE that we're expecting to receive in a few weeks, which should ensure that we can get by a little bit longer. We're currently stable in that area, and we'll continue to monitor this as we move forward. We've also been focusing on continuity of operations and continuity of government in emergency management, along with supporting our partners at the Department of Health and Environment with their increased operations. One of the other things that we continue to do is work to ensure that we're remaining connected and that we have direct communication links with all of our community partners. Since March 2nd, for 8 weeks now, we've been holding weekly meetings with our partners. So each week we have 6 separate meetings with community partners, our long-term care facilities, public safety group, which includes our city emergency management liaisons, our education partners, another one with private sector, one with healthcare partners, and one with general community partners. So we continue to have that dialogue to make sure that we have a good sense of what the impacts are throughout the community. So in emergency management, our goal is to help our community cope with the impacts of disaster, and we feel like this task force is going to play a large role in that, and we're happy to be a part of it.
Okay. Dan, thank you very much. I want to make sure everybody is aware that we have 2 other meetings scheduled after this meeting, Friday of this week at 10:30, and Monday or Tuesday, Monday of next week, which would be April 27th at 10:30, same time.
And Tuesday.
And Tuesday, if necessary. Going back to review where we're at, the governor's order expires on May 3rd. The order from the county expires on April 24th. The governor's order supersedes the county order. So we will continue under the governor's order at least until May 3rd. The governor can extend that order or make changes in that order, and hopefully we'll be able to determine that at least by midweek next week or by our Thursday board meeting next week. So as we proceed forward, our objective as the Recovery Task Force is to outline a plan that can be utilized by our business community and other community assets to have a sound plan in place when that recovery plan is initiated. And at this particular point in time, there is no specific date for that. At this point, I'm going to ask Joe Connor to present the information that he has put together, and in an effort to kind of apprise us as information that's available and what kind of process we might be looking at. Joe?
Thank you, Chairman. So this was sent out to you, a couple of days ago. Hopefully you've had time to kind of look at it, but we've really got 2, kind of main goals for the task force, and I included some references, for your review prior to the meeting. But the first and foremost, we were looking at the task force to determine the phasing of business reopening. That's probably the main purpose. This is what we get a lot of questions about. Everybody I think understands it's going to be a phased opening, but who goes first and how much time in between each phase, and those kind of questions. And then the second one is to adopt the guidelines for the phased opening of the county, and we'll talk about that first. But this is the kind of what Dr. Arreola referenced earlier. It's having testing, surveillance systems in place to be able to monitor the population as we start to reopen for business. How is the infection and how is the spread happening in the community, so we can try to stay in front of it. And I'll keep going. Is everybody familiar with how to raise the hand feature of Zoom?
For the panelists.
For the panelists?
Why don't we Joe, why don't you complete your presentation and then we'll open it up to questions.
Okay, thank you, Chairman. So recovery planning guidelines, we'll talk about that first. There's federal guidance that came out. It's titled Opening Up America Again. Again, there's just basic levels of approach that I've listed there. And, you know, having access to the most current data, pardon me, and having our system ready to go to provide surveillance and contact tracing and those kind of systems are really going to be important as we start to open up the county and remove the mitigation efforts that are in place. I did want to mention that the health department here has been kind of following this approach prior to these guidelines coming out. So we feel like we're in a pretty good spot to implement the surveillance and the testing system. So what's the criteria and the systems that need to be in place? So in the guidance, I use the terms gating criteria. Really what that means is if you looked at the symptoms of our population, the number of cases that we have in our population, and what's our hospital system look like, that's what gating criteria means. And Dr. Ariola can answer some specific questions about those, but we've been publicly producing a dashboard that talks about the cases that we have, about our hospital system, and then some of the trend lines that we're already including as far as our analysis goes. And then the second is the preparedness responsibilities, and this is what I mentioned about testing and contact tracing. Again, if we have a positive case come in, we need to be able to contact that person, contact their close people that have been in close contact with them, and try to again contain the spread. Healthcare system capacity. Again, we're getting information at least on the Kansas side that we're reporting on, and then we need to have plans in place for those vulnerable populations. So a little bit more about the gating criteria or the symptoms cases in hospitals. We're talking about a downward trajectory of influenza-like illness over a 14-day period, and the 14-day period has been widely publicized as the incubation period. And then a downward trajectory of COVID-like syndromic cases within a 14-day period. So the 2 weeks is something you'll see kind of throughout the different criteria that we're talking about here. On the number, and in the number of cases, again, a downward trajectory of documented cases within a 14-day period, or a downward trajectory of positive tests as a percent of total. And we're reviewing both of those in our data analysis. And then on the hospitals, we'd like to have our hospitals that be able to treat all patients without the crisis, that don't need crisis care, and then have a robust testing program in place for at-risk healthcare workers, which Dr. Ariola has just talked about. We're introducing that now. And I'll let Dr. Ariola at some point talk about antibody testing. I think that's still an emerging test for the laboratories to provide for us. So we're not using that at this point, but as that technology and that science gets better, we'll probably introduce that. And on preparedness responsibilities, again, testing and contact tracing, we've got to be able to set that up quickly and try to catch folks as soon as we get the reports. The syndromic, influenza-like illness indicated, be able to test those folks, and then have sentinel sites set up, ability to quickly and independently supply PPE, which Dan Robeson talked about. We feel like we're fairly stable, but supplies both in the testing and PPE remains to be getting a reliable resource remains a challenge for not just us, but around the country. And then having plans in place for, and you can see the list of populations there that we're trying to make sure we have plans in place. So the next part is really the bulk or the meat of what we'd like the task force to work on, and that's how do we identify the phases for businesses to reopen. One of the documents that we sent out to you was from Johns Hopkins, and there's a section in there that talked about assessing risk for organizations and specific settings. And they used easily understood criteria for assessments in 7 categories. I think probably the one that we'd want to focus on is the non-essential businesses, but they also have assessing risk for all the other, those other 7 categories. And the other thing that they do is they show, they have kind of 3 dimensions that they show with each category. So contact intensity, that means, you know, how close are people coming together in those particular settings. The number of contacts, you know, again, it's just a volume issue. And then, is it a modifiable activity? So, for example, a sports arena is probably pretty low on the list of modifiable of venues that can be modified to operate safely in this environment. If it's rated as high, that means there's a good probability that things can be modified pretty effectively to open up that type of venue. So that's kind of the end of the initial presentation. I did want to take 1 second and show the Johns Hopkins information. Just a moment here. So this is if you haven't had a chance to look at that chart, it should be up here in just a second. Bill, it's on my screen, but it's not on there. I don't know.
You need to share.
It's still sharing. Sorry.
I have to get out and come back.
You need to share. Go back to stop sharing.
Don't get too close.
And then do share. And you can do like the screen.
There we go. Okay. Sorry about that. So this is the chart of non-essential businesses, and you can see the table and the way it's laid out. That also has that last column there, mitigation resources. So these are guides that are being pulled together from different.
I'm not sure it's showing it. You might want to ask.
Oh.
Committee member, because I'm.
It's showing the non-essential businesses on my screen, yes.
Okay, thank you. So on the mitigation resources, it actually has guides for the different types of folks to use that they could actually try to adopt and make them operate in a safer manner. So again, for the purposes of trying to get started, this is what we want to try to give you, and just to get your reactions to this, to kind of what the goals are, what you know, the information that we've laid out to you. If there's other information you'd like us to consider, or if you want us to do some research on, like Penny stated earlier, we'd be glad to pull that together and bring it back for the task force to look at. But for the purpose of discussion today, we wanted to at least give you something to see if it makes sense to you for the discussion purposes. And again, with the ultimate goal of laying out the phases and which category is going to be in what phase.
Let me add to that. I know that you've been presented the links to the White House guidelines and the phasing that's suggested there, and it seems to be a good, I guess, step to follow. And also the Johns Hopkins University study, and then also you've been copied with some detail from the U.S. Chamber of Commerce. And to that report, there is, I think, some important business information strictly related to responsibilities, et cetera, that businesses, if they haven't looked at, or should probably look at that U.S. Chamber information as far as business responsibilities. There's another item that has been presented to us. It's not on your screen. It's from the state of Alabama, and I'm assuming you can go to that state network or website and find that study. It is rather lengthy. As I recall, it's about 160 pages. But they do have some sections which are fairly easy to read, broken down into retail stores, restaurants, for instance, and other different kinds of businesses, and the suggestions that they've made as to how to reopen that sector of their economy. Again, it's very detailed and probably detailed to the extent that we don't need to move to, but it is available and you might want to take a look at it. Also, we will be sending out today a copy of the governor's stay-at-home order, which identifies essential businesses and non-essential businesses. Obviously, the essential businesses have been operating. The non-essential businesses have not. And so that's where our particular attention needs to be in both categories, but probably more prominently in what's been considered the non-essential businesses. Dr. Areola, are you still there? Can you speak to the antibody testing? That's a question that many of us have been getting, and let us know where that's at this point.
Thank you, Chairman. I'm still here, and I'm happy to do that. So every time that our bodies are exposed to foreign materials, foreign insults, or what we call xenobiotics, our body will respond by producing certain proteins that we call antibodies. Okay, and so and there are different categories of antibodies. Some of them, and the one that we are hoping will happen is one that will provide some measure of immunity against COVID-19. But we don't know that. In the past, I think one of the general misconsensus is that misconception about this is that every antibody means that you will have some measure of immunity. Not necessarily. And so there is an ongoing national study, NIH, that's looking at whether the antibody produced by as a result of exposure to COVID-19 actually profile some measure of immunity. And if it does, what are the parameters for how long and to what level? Those are questions that has to be answered. However, the FDA, the Food and Drug Administration, under the emergency use authorization, which is really the authorization for a lot of the approvals for tests because of the suddenness of the COVID-19. They've not approved the use of those serological tests broadly. Okay, and so they have approved some of them strictly to be used to develop, to look at the potential for what we call convalescent plasma treatment. It is possible to use those things. In the past, we've used that as a form of treatment, and I believe the company that was awarded to was Celex. That's one approval. I think there's also an approval for point of care, a small test that you can use. But even with that approval, the caveat is pretty clear that you cannot use the serological test. It's not a diagnostic test, number one. Number two, you cannot use that strictly as the basis. In fact, it's clear that from both CDC and KDHE, that for that to be used as a confirmatory test, you have to follow the serological test with the RT-PCR. By itself, it's not enough to use as to diagnose. So when you read that, you are going to see that there are at least two types of antibodies. You will see what is called the IgM, which is the one that's produced early in the infection, and the IgG, which again gives you an idea of previous or infection. That stays longer because the IgM over time would degrade and reduce in your system. So the other thing to keep in mind is if you are testing somebody within maybe the first 5 days of infection, they probably would not have built up enough antibody for your system to pick it up. And that's one of the reasons why it's not a diagnostic test. But here's also what's going on with the test that so many people are marketing. I get literally tens of this every day, is that because we have other coronaviruses, there's at least 4 around, is that the antigens that they're using, that they're picking to do this, is picking up the wrong, it's not very specific to COVID-19. And so we had our friends at KU look at some of the studies across the world, looking at the accuracy, the sensitivity and selectivity of this test. And basically, it's a very broad range, but the conclusion is that if you have 100 positives, 52 of those will be the actual positives, and 48 of those will be false positives. That's not a test that is reliable enough for you to use. Now, there are partnerships across the country, including the one in LA that people reference, that have been done as research that have used. In practice or in theory, the advantage, I mean, the concept is that it will give you an idea of how the percentage of your population that already has immunity. Well, first of all, we have got to answer the question of whether the antibody produced as a consequence of exposure to COVID-19 actually offers immunity. But even if it does, like the early study says, you can't really make a judgment, and it gets tougher when you are deploying this, when infection rate is below 10%. It tends to be more sensitive when you have infection rate that's much, much higher, 80, 90%. At about 10% or less, it's not as effective. Would there be benefit to it in the future? I am sure. As a government entity for us, unless it's done as a research study in collaboration with some of the local academia, for now, for me, it's not specific enough. It's not been tested or perfected to a level that it helps me. Right now, what it does is just gives people false hope. So there are clinics that are doing that, and people are living there thinking that they have immunity. No, they don't. We don't know enough about that. Now, there are studies that are not proven also that are suggesting maybe even reinfection. We don't know that either. And so I don't want to give credence to studies that are not proven. But again, just like at one time, there's a lot of talk about hydroxychloroquine and all of those things. We have to give ourselves enough time to make sure that these things are proven and tested using scientific known procedures to do that. Now we're hearing that, which a lot of us who have been in this field know. I'm a toxicologist, for those that don't know. So when some of us saw the news about hydroxychloroquine, we know that we're really jumping the gun. What we are saying is it may not work. So let's wait until we have confidence in the study and it can add to our body of knowledge. Right now, we're not even close to that.
One introduction that I failed to make, and Dr. Joe Lamaster is the Public Health Department's medical director. He is in private practice as a physician at KU Hospital, and he was unable to join us today with his schedule, but he will be with us in future. That position is created by state statute. Authority is given to that position by state statute. I should also indicate there is another feature. The Board of County Commissioners in Johnson County sits as the Board of Public Health. And so that Board of Public Health, working with the medical director and public health director, will coordinate decisions going forward. But the medical director does have the ability in some areas to make decisions on their own. So I just wanted to make that clear. Are there any questions over any of the material that has been presented so far? Okay. going forward,
Mr. Hanslick has raised her hand.
Commissioner Hanslick, I'm sorry.
Thank you, Chairman. I appreciate that. I just wanted to ask a question of Mr. Connor or Dr. Areola, back on the slide about gating criteria, where it talks about symptoms, cases, and hospitals. I just wondered if you could help us understand, for example, under symptoms, it talks about looking for downward trajectory of the influenza-like illnesses reported in a 14-day period and downward trajectory of the COVID-like symptoms. Is that what is? Are we using the public surveys to determine those trends, or which data points are we using to look at that? And then also the same question with the cases. What data points should we be looking at to determine the trajectory of that information? Thank you.
Okay, Dr. Areola here. Thank you, Commissioner Hanslick. I'll be very happy to answer that question. The downward trajectory of influenza-like illness, we routinely collect those. We have sentinel sites, but we also have what we call syndromic surveillance, where we take, and that's also true for the COVID-like syndromic cases. I believe that Elizabeth showed some of those trends on Thursday, and we're happy to provide that. But those are things that we track over time. We'll pull out symptoms that are consistent with COVID-like for that, and then we'll plot the numbers over a period of time. So no, those are not from the symptom survey. Those are from ED, emergency department data, and potentially other sources that we pull and we plot over time. In terms of the documented cases, we have those on the joko.gov site that we show, and it's whether it's just documented cases. We are tracking that daily and updating those numbers every day. And also, I believe that we've added the positive test as a percent of total tests, trying to go to so on the Joko website, our coronavirus page, the very first graph to the left is looking at cumulative cases tested and positive. That's tracking that daily number. The yellow portion is the daily number. And if you look at that, it's tending towards being fairly stable. But like I've said, that downward trend and staying flat at the peak level is not as positive as a downward trend below the peak level. And so we want to see that go down also some more. Again, because our denominator has expanded, because we are testing way beyond the stringent condition that we put. We're actually testing some people without symptoms. And so the percentage may not be the best indicator, but when you get into the details of actual number of cases, that's working. I think we have graphs there that plots that by onset date. We have them by other demographic data that are there. And the last part, which is your question, is plotting by positive tests as a percentage of total tests. It's not showing on this website right now, but we also have that. And so those are not coming from the survey for symptoms. These are coming from actual testing, lab analyzed data.
Thank you. That was very helpful. I appreciate that, and certainly would commend to all the other members of this task force to familiarize yourself with that dashboard. It's extremely helpful. Thank you.
All right. Are there other questions up to this point? All right, if not, let's talk about next week's meeting. And I will go back to the guidelines presented by the White House. Those guidelines are somewhat general, some specifics, but very much focused on whether you're an essential business or not, social distancing, providing a safe environment for your employees, for your customers, and in some cases they mention masking, and so that's the general guideline. And I guess unless there are other thoughts, and certainly make those thoughts known, if we could focus next week on fleshing out those 3 phase periods and what businesses are included in each period, and we can rely upon the Johns Hopkins information for that. You know, some of the biggest questions are going to revolve around movie theaters, event spaces, restaurants, and some of the smaller businesses such as hair salons, nail salons, and barber shops, and exactly what recommendations are going to be in place for those facilities to open to the public, and what step in the phase process do these facilities come open. The other question that needs to be addressed is, you know, how long is phase 1, phase 2, phase 3? And so what period of time will we be looking at? I would also encourage you, if you haven't gone to the county's website, jocogov.org, the dashboards there, that information is updated every day and helps us make decisions going forward. I would also direct you to the Kansas Department of Health and Environment, their website, and they have additional information with positive testing in the entire state, broken down by counties. I think in the state, Wyandotte County has the largest numbers. And again, our numbers and those numbers are cumulative. So keep that in mind as you look at those numbers. So if we can focus on that aspect, and again, if there are other thoughts, please.
Penny and then Mayor Mickelson.
Okay, Penny?
Yes, with Frank Link being on the committee, I was wondering if there's some data, economic data that he has gathered that may be helpful for the committee. And so maybe take a minute to see what he's got, if it's helpful, or if there's questions of him, let's not forget that resource is here. And then after that, Mayor Michelson has his hand raised.
Okay. Frank, can you give us a brief update as to what you see going on?
Well, we're still collecting data. I'll be interested to hear the perspectives of everyone on the panel. It will help me do a better job of doing the forecast. The data that we do have is national data on how we expect the economy to perform. And we're probably in the midst of a pretty severe recession right now. And the betting basically is that while we get a quick rebound after after we start to reopen, we won't see a full recovery until there's a vaccine, and so that's a year to 18 months away. And even then, it might take a couple of years to actually achieve to where we would have otherwise been, where revenues would meet our prior projections. So it's likely to be not just a sharp and short recession, but a little bit longer. and there may be a resurgence, as we heard yesterday from the CDC director, in the fall and winter. And so how we do this so that we don't have to shut down everything again is just critical. And I don't have any better insight into how to do that than the rest of you. But you know, the data that we look at is the same data that everyone's looking at. And on the economy, the most current data is the data on unemployment claims. And you know, those are still in the millions nationwide. And they were only running at about 200,000 before this all started. So the sooner we can put people back to work, keep them attached to their employers while they're not, you know, the better for the economy. But we have to do it in a way that doesn't cause a resurgence, and then we have to go through this all over again. It'll be worse the second time around.
Okay, any questions for Frank? All right, thank you. Mayor, you had a question or a comment?
Yeah, not necessarily for Frank. That was very helpful, but I just had a general question, maybe for you, Chairman, or anybody in the group. You know, the plan of action sounds good and appropriate that you've articulated. I thank and commend Joe and Dr. Ariola and Penny and everyone for the presentation materials. They've been very helpful. But a threshold question in my mind is, it sounds like the county at the health department level, at the emergency department level, is coordinating with the state very well. At the higher policy level, at the governor's office, we could do a lot of good work, and maybe we should anyway until we have certainty. But then if the governor chooses to implement statewide reopening guidelines, all that could of course be superseded at the state level. Do we have any indication from her, and can we, if not yet, can we make sure we get it in real time when it develops as to whether she's inclined to go with statewide phasing after her order expires, or whether she's going to give some discretion and deference to counties like Johnson County or other counties to do what works in their particular locality?
I think she said you want Stan to talk about it.
Mayor, we do not know the answers to those questions. I would, the governor does have a news conference, I think a conference call every Friday.
Yes.
And so that would be a good source. I was unable to sit in on the one last week, but I am told that she did speak briefly to a regionalism, perhaps, but I don't think there's anything particularly decided at this point. I think she also mentioned that the state was putting together a recovery plan, and no details on that. But my guess is perhaps this Friday, being as close to only 1 week away from the approximately the state's plan expiring, there might be more details.
And Chairman, Stan Home on the chat for this meeting offered an update from a governor call. I don't know if it's as broad as what Mayor had just asked, or if it was more from the healthcare perspective, but Stan may have information, it looks like, from the chat.
Okay, Stan, can you speak to that?
Yes, Mr. Chairman. Really, it was a great conversation. She had pulled together about 10 different CEOs of health systems around the state and asked us, what were our thoughts for our readiness from a health systems perspective to really lift the stay home and then also the reentry for businesses. And collectively, all of us had indicated that, we look at it from a space, a staffing, a supply, obviously supply being PPE for the most part, then our standards of care. A couple of weeks ago, the space issue was a big concern on why we stopped our elective procedures and other things for our businesses, and while obviously the stay at home followed that. But as we talked to her, it was pretty much unanimous that from a healthcare perspective, we were ready for her to lift that and be ready for the reentry in the next week to 2 weeks. So her May 4th timeframe we did not encourage her to extend that. So I think it's important for this task force to know that one element. The second element that we talked about was that one size does not fit all for her entire state. And so she heard from obviously the major players in Metro KC area, for which Johnson County has them in it, and then also some non-urban locations and their emphasis to come back on to do their elective procedures from a business perspective. So of course in healthcare, we wear two hats. One, the recipient of the critical patients or those that are testing positive with symptoms, but the other side of our hat is some of your largest businesses in your communities and in other communities. And so she heard a consistent theme that we are ready from both perspectives. One, from a healthcare organization's safety, because we feel like we have enough PPE from the moderate trajectory of what this is going to cause to be able to handle the PPE that we need. Of course, testing was a big issue for all of us for what that looks like. But from a business perspective too, for us to allow patients to come back and see us. She got the message too that from a patient perspective, there are a lot of patients that right now with the stay home orders are needing to seek care that are not. And she received a couple of examples of patient delays on that. But her messaging on one size does not fit all, she really had an emphasis from my perspective. Of course, she'll be the one making those statements after a summary of our conversations. But the direction we were hearing was that she saw that the reentry for the dates she was looking at looked favorable from not extending that any further. And that with one size not fitting all, she put an emphasis on the counties. I think she recognized that there are county dynamics that may be an emphasis for where she might encourage the county to lead the way. Now, please recognize I am not putting words in the governor's mouth on this, and she'll make formal statements, but these are my perceptions that it was related to the fact that she was encouraging us by the voice from what she heard from the healthcare facilities on reentry, and that counties will likely help lead the way.
Okay, well, thank you very much for those comments.
Tracy Olchen.
Tracy Olchen, do you have a comment, question?
I do. Thank you, Mr. Chair. Really, this is kind of a follow-up on both of these comments. The chamber presidents for the county and for the Kansas City region have convened twice in anticipation of this particular meeting, just to talk about collectively what we've been hearing from all of our businesses. And it's very much in line with what you read in the President's Task Force, with the Johns Hopkins study, with the Alabama study. It's all very supportive of, a phased approach, spacing in between each of the phases. Also, the Kansas Chamber has a good approach to return to work. But each one of those has the component that it's safety first. And so even as, we hear from our businesses every single day, whether they are, the smallest of businesses up to our largest, each one of them has been very careful to let us know that, until their workers are assured and that they have a safe environment to come back to, and they know that their clientele has a safe environment to come back to, they don't want to come back to work no matter how much they need that revenue. And so it really kind of goes to the heart of what Dan reported, that the county's working very hard to make sure that you have enough PPE and supplies for healthcare workers and first responders. But what we're hearing across the board from our businesses is they just can't get those supplies. And so, even if you open your business up, they're saying all those basic things, they can't get masks, they can't get hand sanitizer, no wipes, appropriate levels of soap. And so, I think that's something that as a task force, we know that that's going to be a component of best practices, in addition to spacing and capacity and all of those things that are part of allowing people to open back up. But we can't tell them that that's part of it. They all know that it is. If, I know that for our own business, the chamber opening back up, when we look at some of those supplies and we're told we can't get them till mid-June, that's not helpful. So, while, I can wait to open back up, some of these retailers or restaurants can't do that. So, I'm wondering, is that something that the county or the state can be helpful in procuring some of those supplies for our business community? So that's something that is going to keep it, at least in particular, our smaller companies from being able to open back up. The big ones may be able to access those their own way, but the really little ones are going to continue to have trouble.
Okay. Well, Dan might be able to respond to this, but we did put in an order, I think about a week ago, with a local vendor. And as most of these tests and materials, they're coming from China. This order is coming from China. And the timing, I'm told by other sources, it's really problematic as to when those materials can be delivered in a timely basis. Our focus on that order was to be able to provide first responders and healthcare workers with those PPEs. And Dan, as I recall, our current supply is about 4 weeks worth. Can you elaborate?
That's exactly right. When we made the purchase, we felt like we had, for those groups you mentioned, public safety and healthcare workers, we had about 4 weeks. And when we receive these items, we feel like it will keep us stable in those areas for that amount of time moving forward. But that's a good point from Tracy, that to consider the additional stresses that and needs that may be out there as we look at these reopenings.
I guess I would simply add this. The CARES Act, which has passed Congress and is available, and I understand there's other action that's being considered. Maybe there's an opportunity for, and I'm just speculating, cities, local government units, as well as county, to cooperate on some of these efforts. But no question, Ms. Olchen, that's an excellent point.
Okay, Chairman, I wanted to bring up, Frank had a couple of questions that he put into the chat. I think the first question talked about our readiness for the surveillance and testing. I'll let Sami correct me if I'm wrong, Dr. Ariola if I'm wrong, but I think that on the surveillance piece and the contact tracing, we're in fairly good shape. We're working on securing some additional budget to increase capacity there. But they're doing it now, and they have some capacity. The issue remains on the testing with, and I said it earlier in my comments, about reliable sources of supplies. As Dan said, PPE, we're at a 4-week level for our first responders in the county. I mean, that's okay, but again, we could be overwhelmed fairly quickly with that. And as far as laboratory testing, it's the swabs and the media that's used to perform the test. Those are just been unreliable sources, very spotty at best. We've done our best to, again, with the help of folks like Stan and others, to cobble together a testing program to get started. But again, the reliable source of those supplies is just not available at this time. So that remains a challenge.
I think should probably, to reinforce that, I think our first order went out. We asked for 5,000 swabs and testing, and nobody could accomplish that, quite frankly. And so we've been engaged with other local organizations in the metro area, maybe 200 or 300 at a time, or maybe 500 at a time. So we continue pursuing those options. There is or was a metro-wide effort of private contributors who ordered significant numbers of those test supplies, and that was about 3 or 4 weeks ago. And so far, to my knowledge, none have been received. So
Stan has offered to give his experience on obtaining supplies, and then Julie Brewer has her hand up.
okay, Stan, can you give us your experience?
Yes, and I'm assuming this same experience will go for the non-healthcare related organizations, obviously from the supply management of things, and specific to PPE. I'll actually just focus on masks to give you an example. We have early on in this phasing looked at what we call level 1, level 2, level 3 masks, and then we go into respirators for your N95s and PAPR hoods. When you look by types of masks, it is amazing the complexity in what you get for masks based on where you're receiving them from, as well as what they say on their boxes and what you can look at, to where healthcare organizations have really started going in more global terms of, is it a barrier mask or is it a protection mask? And when we think about our sources and we looked at our moderate curve now on what we're looking at from the types of cases we're seeing, collectively, a lot of us looked at our projections for our mask use to safely protect our staff, our providers, and our patients, modeling after what we're going to see in the worst case scenario of more COVID cases. Do we have all the PPE? But I'll particularly just talk about masks because that's a key one for other businesses outside of healthcare. And we found that we do have enough supply now. We didn't in the first 2 weeks, and nor did everybody else. But now we have enough supply from our primary sources and our secondary sources. But to give you an example, our primary sources right now give us an allotment per month and say, here's all you can get because we're trying to distribute that everywhere. And our secondary sources have been able to provide us additional masks that we need across the scale from both barrier masks and what we need from protection masks. But when you look at what I'd call maybe our tertiary level of masks, these are individuals that are companies that they heard there's a need. They were not in business doing masks a year ago, and they're now saying we can provide you these masks. And many of you might in your businesses have heard about these companies. We have found in our vetting process that probably 10 to 20% of them, so every 10 that we get, 1 to 2 of them, one, are validated as companies that are legitimate. And then on top of that, even out of those 1 or 2 that say we can provide you the masks, when you talk about ordering it, the nomenclature we see in healthcare is, I'll believe it when it hits the dock, because many, many times we look at ways that we're ordering and it never shows up. And even our primary and secondary sources, where we're looking at our turn rates and making sure with our burn rates and what we can order, sometimes there's even delays in those we have high confidence in. I tell you that just that as we're looking at expanding to businesses and knowing 2 things. One, businesses are already cautious of protecting their own associates as well as their patrons. You might have some natural tendency as we talk in our healthcare teams now is turning the dial up slowly, but also recognizing by the fact that we may not have the PPE, let's say 30 or 60 days from now, however fast that goes, to have the strategies to dial it back down as well. But one of the things that might be a consideration for us to look at is to stay away from the higher perspective of, sorry, can you all still see me?
Yes.
Okay. So the one thing that you may consider is if you can get what we are looking at as our tertiary resources that really are smaller volume of vendors that say they can produce, several hundred thousands of masks, have that available for businesses and what that may look like. But also recognizing that if we keep that in the level 1 mask category or barrier only, you could emphasize, and this is just Stan speaking, but by the way, I'll give you another side note. Dr. Areola is an outstanding addition to your team. The way he articulated what's going on and his knowledge about how he's approaching things is right on. So just encouragement back to you that you hired right. But having him also look at what we're looking at from barrier masks being homemade masks. So if you were to encourage businesses to look at 2 things, the barrier masks that people could buy either by vendors that are out there for level 1 masks or homemade masks, yes, there's a discrepancy of how much that protects you between 40 and 50% from homemade masks and potentially 92, 95% from level 1 masks. and 95 to 98, depending on what you're looking at. The key to that may also be face shields. So as you look at inventory problems, as businesses want to ramp up, they're going to naturally want to keep the social distance of 6 feet where possible. They're going to naturally want to phase it in just from fears of what can I do to protect people. I may encourage the strategy to tie into the homemade masks and the level 1 masks that might come from what we're looking at in healthcare as our tertiary vendors. And then also there is a lot of strength in these individual companies that are creating face shields. So we might be looking at a combination for other businesses outside of healthcare to look at those homemade masks, level 1 masks with a combination of face shields as strategies. And that's just from my perspective to protect what we need in healthcare, but also look at what businesses may need.
Well, that's a good point. Thank you very much, because I think there are a lot of some volunteers and some other efforts to make those face masks that I forget the term you use. It was a level 1 or level 3, where it's just a minimal protection, but at a certain level.
The minimal protection is the level 1s.
Level 1. Okay. Thank you very much. Ms. Brewer, Julie Brewer, did you have a question?
Yes, I just want to kind of echo what Tracy was saying earlier about her constituency of businesses as they look at safety precautions to be able to ramp back up and reopen. We have that also with our health and human service sector, who also has had barriers getting access to PPE and access to cleaning supplies to adequately sanitize spaces when they are trying to do in-person programming. The other barrier they're facing is, as you can imagine, even in the best of times, the sustainability of funding of a nonprofit can be precarious. And so you do a lot of creative solutions, including using a large volunteer component to help supplement your direct service programming. And at this point in time, many of those agencies have had to severely restrict volunteer solutions as they try to do their essential services, or they've had to eliminate volunteer solutions. I can't imagine they'll start ramping those up unless they have some level of access to PPE so that they feel comfortable that their volunteers are adequately protected. And some of their biggest barriers, not only just getting access as in true availability of sanitizing items and PPE, is just the prohibitive cost when they're already working under very constrained fiscal situations. So that's an area that I'd like us to be thoughtful as well as how can we remedy or think out of the box solutions for them. Thank you.
Okay, thank you.
Tracy and then Commissioner Hansley.
Tracy Olson?
Unless you still had her hand up.
Tracy, did you still have your hand up?
No,
all right, I guess
I'm done.
not. All right, thank you. Commissioner Hansley.
Thank you. This is a question, perhaps Tracy can help with it. In looking at the U.S. Chamber information that Joe Connor had sent out, I noticed one of the concerns that was expressed was the liability for businesses, and it would also apply to nonprofits, for using things like homemade masks or using, as Stan Holmes said, the level 1 masks. How much of a concern do you think that is, Tracy, in terms of providing businesses or businesses providing their employees with that protection and the liability issues involved?
Commissioner, that's a good question. I think that chambers, at all levels are concerned about, and not just homemade masks, but, all of the things that we're talking about. This has been expressed by all of our local chambers. The state chamber addresses that in their back to work program. And then of course the U.S. Chamber is addressing it across all industry sectors. So when you look at certain industries talking about taking employees' temperatures before they're allowed to come back to work. I've heard that There are certain Fortune 100 companies that are not just taking their employees' temperatures, but also requiring that of clients before they're allowed even to access the buildings to come in and meet with employees. You know, and yet you've got all kinds of privacy concerns. You have potential litigation if an employee or even a client or a visitor feels that they were exposed to an unsafe condition when they came into your workplace. And so all of that is, at this point, uncharted territory. And then you've got the issue, you know, many of us on this call are employers ourselves, and yet most of us, except probably those who work for the county, have not been trained in how to train our own employees to use masks or other PPE. And I certainly don't know how to, you know, take the temperature effectively of all of my own employees and safeguard their information. And yet there are certain guidelines that say that that's what I should do in order to ensure a safe workplace. So, you know, there are lots of legal questions, not a lot of legal answers, but there, I think, are guidances, you know, that are thrown out there as considerations. But the U.S. Chamber also notes in their document that just because these questions exist, it should not be a barrier for the country or counties or cities or states to start opening and coming back to work. And so, you know, we need to consider those issues. But we also have to, when the data tells us that, you know, we're leveling or we're decreasing our cases, we have to consider those things and, you know, make a safe workplace, but we still need to start opening back up. So I think that helps.
Yes, thank you so much, Tracy. I've been trying to speak to a cross section of businesses in my district. And for example, spoke recently with a principal of an architectural firm, and one of his concerns was, for example, with the temperature taking. He said, I don't know if we're going to need to actually hire a nurse to be there every day when we open back up, because as he said, I certainly don't have the qualifications to take people's temperatures and keep records of that. So I think those are a lot of questions. I also talked to someone who owns an athletic fitness facility. He has a fantastic plan for opening up. In fact, he said he's already spaced out all of his equipment, and I was very impressed with what he's done. But again, having masks, having sanitizers, those things are big barriers. So I appreciate your addressing that, Tracy, because I think we do need to bear that in mind, what it will mean to businesses when they need that kind of equipment. So thank you.
Scott Anderson.
Scott Anderson.
I don't know if he kept his hand up.
Scott, did you have your hand up?
Oh,
I think not.
He's
okay.
muted. Scott, you're muted.
All right. Well, you know, to follow up on that, it was a couple of days ago, I think Walmart made an announcement that nationally they're requiring all of their employees to wear those level 1 masks at least. And yesterday I didn't hear the entire program that Target had rolled out, but again, requiring or allowing only a certain number of customers in their building, and also some employee requirements. And I know there are other businesses who have been considered essential who have been practicing similar tactics as far as limiting number of clients in their business. And so I think going forward, as we look for these phases, that's something else that probably needs to be considered. And Tracy, I have one question of you. I know the Alabama program came to you from the executive director of the Olathe Gardner Edgerton Chamber. And if you have that link, can you send it to the other task force members who
absolutely. Yeah, I will send that to everyone after the call.
Okay.
And Scott Anderson was trying to talk.
Okay, Scott?
I believe.
I figured it out. I will say this. I know with respect to our restaurants, over the past week, we've been accumulating the basic face masks, a lot of hand sanitizer, other things of that nature, really not having that much issue at all acquiring them. Unfortunately, having to spend some money to do it. But, you know, the second thing I want to point out to the group too is, as you all know, the second round of PPP funding has just been authorized. Most businesses will know that whether or not they receive award by early next week. We don't have enough time now for me to list all the business owners I've talked to that are going to make some pretty significant decisions when they find out whether or not they got an award in that second round of funding. I can tell you we have restaurants that we will permanently close if we don't get an award in the second round of funding. I've talked to a lot of other people that are looking at that same decision. So while I'm certainly not advocating, I think I'm probably going to line up with the thoughts of a lot of the healthcare professionals in this group, not to do anything unreasonable. I do think it's important to show people there's some light at the end of the tunnel, because you've got a lot of business owners that are really going to start pulling the plug starting next week, I think, especially small business owners. Thanks.
Okay.
And
all
then,
right. Yeah, go ahead.
Real quick, Stan, quick question. I think this is what you said, but are
Scott, you're cutting out.
The cloth ones and the face shields, are the face cloths? Yeah, Stan, is your opinion, are the face cloths and the face shields of equal value? Does that make sense?
It does make sense. Can you hear me?
Yes.
Yeah.
Okay. I would dangerously answer this knowing my infectious disease team and my quality director would make sure I'm clear in how I say this, but I would share with you that I think a quote from one of the infectious disease doctors at KU had indicated he had been exposed to more COVID patients with a general surgical mask and a face shield that he felt very confident protected him a great deal. So what I would share with you is, and if probably as we've evolved from level 1, 2, and 3 to be more barrier mask versus protection mask, we probably should, Chairman, use the term barrier mask, because that does include your level 1s and your homemade masks. And I would say to businesses that if they had the capability to either acquire those level 1 masks and or homemade masks, that would be a good start for what our infectious disease team would probably say. But I will tell you the education I got, as you can imagine, I've been completely educated on types of masks more than I thought I'd ever be. But face shields, because it's droplet related, if it's a full face shield, there's a lot of strength in what it provides to individuals. And I know there are companies in our counties that have converted some of their manufacturing plants and others to create these face shields. I think that would be a favorable method. One of the things I also would share that what we had to learn to live with in healthcare was, as CDC would give us, improving and changing parameters throughout the last month or so, is what's highly recommended, and acceptable. So I think as a task force, we need to also keep in mind that as we're looking at all the different factors of what we try to create for the commissioners and what that would look like, is to be comfortable with the understanding that you're going to get guidelines that are recommended, and there's also it's okay to have safe, acceptable responses to this too. And where the difference is really in availability of PPE. So I think the balance is, can you open in the next 2 weeks? Highly likely. Can you do that in turning the dial very slowly? Still limiting the 6 feet for us, still limiting visitors for our post-acute centers, talking to them, absolutely still limiting visitors. But the key to PPE for businesses and keeping their staff safe and their patrons, encouraging but not requiring them to look at those barrier masks or shields, or barrier masks and shields, would be things that I think may be more available for them than anything else that we're going to suck up in the first responders and healthcare organizations, to where they can slowly bring that back. And understanding the messaging that even if they don't do that and they want to start their businesses, and Dr. Areola, if you could chime into a CEO's perspective as opposed to a provider's perspective, perfectly comfortable with that. But to be able to understand the difference between what they might read that they would see as recommended versus the word acceptable. I think there's a big range in there that we had to get comfortable with, even inside of healthcare when we were strained with PPE several weeks ago.
Good comments. Good comments. Chief Troy.
Well, my question has something to do with what Sam was just speaking of. It sounds like we're talking a lot, and I think the recommendations that the task force will put together is not only what businesses can or should open, but I'm curious to know your thoughts on how much we should dive into what those businesses look like when they do. And it sounds like, as I'm trying to get ready for the next meetings and where I think we want to go with this, how much time and energy should be spent on if the businesses do open, how much do we want to get involved with what they look like once they do and what parameters are put in place for that?
Public health.
Yeah, good question, and probably need an advisory from the public health department on that. But excellent question. And I referenced the Alabama report. There's a lot of details there that probably we don't want to go, but it could be helpful information as background. And then as I look at the White House guidelines and Johns Hopkins, I think that's probably where we need to come with or pursue recommendations.
Perfect.
On the part of the task force. Yeah.
Thank you.
Scott Anderson, one question that I had for you. I know on a national effort, the restaurant associations have been looking at this issue. Do you have access, or is there a best practice for restaurants that you could share with the task force before next week?
Chairman, certainly. There's the National Restaurant Association has put out standards. A lot of businesses have put out standards. Someone just shared with me this morning the standards that Morton Steakhouses uses in Asia. They've been pretty successful with. I'd certainly be happy to share those with the group. One thing I want to stress is business owners have no expectation of opening with no standards. I mean, there's no desire to. If I opened a restaurant tonight with no standards, guests would come in the door and look at me like I was crazy. So I think we're all for reasonable standards. It's in everybody's interest, including ours. If we don't show our guests that we care, they're not going to come back. But yes, I'm full of restaurant standards. I've got them from restaurant chains all over the country and from Asia. I'd certainly be happy to put some of those together and share them with the group.
Well, I think if there's one general approach, that would be good. So if you could share those with the rest of the task force, that'd be great.
I'll do that.
All right, Mayor Michelson.
Yeah, thanks. Just a couple of related guidelines or concepts. Not a lot of, I don't have the answers here yet, but I know from a city's perspective that's been trying to manage this for the last month or whatever it's been, these are some challenges we've encountered where I think this committee needs to be mindful, and I know we will. One is, and I don't have preconceived notions about this, but you take the restaurant standards we were just talking about, making it clear which of those are guidelines and recommendations versus rules with the force of law. And I don't know, we all expect that we're going to get widespread voluntary compliance, and I'm sure we will, but we also know that there's going to be on the edges, people violating those. And that's been an ongoing challenge for my police department. I think police departments generally, because ultimately, whether it's a governor's order or a county order, it's the local police who are getting the calls about a reported violation, too many people in a group together, or people going to this business when it's supposed to be shut down. And I think we need to think about establishing a clear path for what is enforceable and how and where. Is it in the municipal courts and the district courts? Hopefully we will not have to go there much, or are these going to be more voluntary guidelines? And I'm guessing we'll end up with some in both categories, but I think we need to think about that as we establish these. And related to that, uniformity is very important to make the enforcement aspect easier. We talked about to the west of us and the rest of Kansas, to the extent we can, at least be aware of what they're doing. I think there's some advantage to that. The same thing to the east of us. We share in Prairie Village and Leawood and other cities a long border with Kansas City, Missouri. And if we have something open, whether it's a pool or a barber shop, and they don't, or vice versa, there's going to be, I think we need to count on some cross-border flow, and maybe some of that's good, maybe some of that's bad, but I do think we need to be mindful of all of that. I mean, if one barbershop opens somewhere within a 20-mile radius, that could very quickly become the most busy barbershop ever in the state of Kansas, right? So we just need to think about uniformity to the extent possible. Same thing with pools and enforcement would be my suggestion. Again, without any clear answers yet there as to what that looks like.
Before you
Understand, yes.
Before you go to Commissioner Brown, I think Chief Reddick can probably answer his question.
Okay, Chief, can you respond to that? How have you been enforcing what's on the books?
Well, since this has began, there's been a great communication going on amongst not only Johnson County chiefs, but there's even been regular phone calls with Metro chiefs. Across the board, the emphasis has been education. I think the progress that Johnson County has made during the course of this thing, not only in the trend lines we're seeing and just in general, Johnson County, I think we all agree, has done a great job with this, with very little, if any, enforcement action having to be taken at this point. But there's been consistency, not only with Johnson County amongst the chiefs and the agencies, but also in Metro-wide as well. And like I said, the communication's been fantastic throughout this thing.
Yeah, I think the sheriff's department has also used that process.
Oh yes, absolutely. We've been in conversation, and I didn't say that. Absolutely, the sheriff's department has been involved from the get-go as well.
And the DA, I understand, and legal.
Yep. Oh yes, yes. Thank you for that. Okay.
Vice Chair Mike Brown, you have a question or a comment?
I do. It's more of a comment. Thank you, Chairman. So I have heard from, I don't know, 40 or 50 business people since this was announced, have come to me, the majority in my district, but some from scattered across Johnson County, have come to me and are pleading their case that they're teetering on broke. Some of them are small enough businesses such as barber shops and hairstylists that they're one person business shop, so they don't qualify for unemployment. They're the only employee, and you can't claim yourself when you own the business. You can't claim for unemployment insurance. And then conversely, they're not near big enough to go to a bank to get part of this payroll protection. They're getting caught in this mess and are coming forward with some solutions. And the two lanes that I am hearing from hands down the most are those in the restaurant, food service industry, and those in the barber or stylist hair care lane, those two lanes. And both of them have come forward with ideas about ways to separate and protect. I mean, obviously when you're talking about a barber, or, I don't use a barber, for anyone who wondered, I don't go to one, I am my own barber, but for those who do go, I remember the days, that's that's less than an arm's length distance. That requires a different level of consideration. And I'm bringing those two lanes up because they're the two I hear from the most. I think they're the two that are the closest by and large across the board to being flat broke or bankrupt right now. And this task force I think those 2 lanes need to be prioritized, Chairman. As I understand, there's much to be considered, but those 2 lanes, I think we need to put them at the top of the priority list. And I'm sure I will hear from others that they want to be considered in that top priority line. But those are the 2 I've heard from the most. I suspect that's true for all commissioners and maybe everybody on this call. That those are the 2 lanes I hear from the most. And, you know, I'm not advocating that they should be open now. I'm not advocating I'm not advocating that at all. What I'm saying is we need to give them top priority into helping figure out. And I've asked both of them to help provide some ideas. I'm not a barber. What do you think? What is your industry? What can you collectively agree on to move your business forward in a safe manner? And so I've asked them to help us as a collective group with some guidance and some guidelines from them as professionals in their industry. So that was the extent of my comments. I would just like to see us prioritize both restaurants and then the barber hairstylist lanes, because those are the people I sense that are the most desperate right now, trying to figure out what they got to do to try and get open. Thank you.
Okay, good comments. I've had those contacts and those conversations also, and I also have asked for suggestions or ideas as to how they could get open and comply. And I know I don't go to a hair salon, but I do go to the barber shop, and a 2-chair shop, and the chairs are not 6 feet apart. And obviously, if you're providing that level of personal service, then the 6-foot separation, you know, cannot be accomplished.
Is the problem.
So
they're looking for the opportunity, Chairman, and what you said, that I had somebody mention that exact scenario, and they said, look, 1 chair, 1 person in my shop with 1 chair, so that I can at least start generating some revenue to pay my rent and keep things moving, keep the business moving. So that industry have found, and the restaurant industry also, they're very malleable. They're not trying to end run or go back to where they were 5 weeks ago. They're just trying to figure out how to do it the right way. They also have peer pressure. There is such a thing as social media, and if you're flagrantly breaking the rules, it ain't going to take long for that to bubble right back up, and then there's a public shaming component in there too. Thank you.
All right, thank you. County Manager, did you have a comment?
Yes, I just wanted to do a time check. It's 12:20. We had initially asked for 2 hours, and if there's willingness and a desire to continue, then we can continue. I just wanted to point that out, and not sure if this is the time, but I will offer a perspective of maybe possible next steps. And so what staff could do is take I guess a draft of some next steps for your consideration on Friday, or would the committee prefer to have committee members bring ideas that then we follow up on? So either approach we can adjust to. I just want to offer staff, if based on what we've heard, to do the best we can, and then others bring that and add to it, change it, react to it. Joe, do you have other thoughts?
No, I think it's just the will of the task force. I mean, we can do either way. We can do the research and bring back a very, very rough draft product, you know, for review, or we can compile your ideas and then you know, work with that and then bring back a product for the following meeting on Monday that would maybe be a little bit more polished. So whatever the group think is the best approach, we're glad to accommodate.
Yeah. Well, you know, one approach, and you know, looking at the federal guidelines, looking at Johns Hopkins, looking at other details that we know, which have just been talked to, hair salons, barbers, those kind of businesses and restaurants, then we can plug that information in to those that phased program that's been outlined. So if that's, we can have the staff enlarge that, and then present that for discussion, or we can simply accumulate the task force ideas in that regard and then move forward. And either one works.
Commissioner Brown raised his hand again.
Commissioner Brown?
You're on mute.
Sorry. Thank you, Chairman. Just a comment along those lines that I have no problem with bringing forward a skeleton outline, but I want to make sure that everybody that's a part of the task force understands that it's simply an outline, and there is it's what still that is simply a structure to build the conversation around, so that everybody's opinions are still on the table, and it is by no means is a definitive document. It's just
absolutely. So look at the guidelines from the White House. Look at the John Hopkins study, and then bring your specific ideas to how we accomplish those phases for different categories. And we will send to you today the governor's order, which identifies the essential, non-essential, and and then we will meet again 10:30 a.m. on Friday.
Tracy's going to send the Alabama link.
And Tracy will send the link to the Alabama. So, all right, are there any other questions, any other comments?
Looks like Chief Reddick has his hand up. I'm not sure if that was still up from before. It looks like Commissioner Brown, I'm not sure if those are still up from before as well.
I do. I'm in.
Do you have a comment, Mike?
I do. I thought Chief Reddick was going first, so I'll jump in. Can we get an email with everybody's email addresses on this task force and maybe just general contact information to make sure we all know how to get a hold of each other in a list? Sure. When I get stuff or when others get things, I would love to have it go ahead and be circulated so that we've all got a chance to read it before we get to the next meeting.
Okay. All right. Thank you. Chief?
No, I just had not got my hand taken down yet. I'm fine.
All right. Okay. All right. Well, if there are no other comments, let me say thank you very much for your participation. Good discussion. We are on a tight timeline, and so Friday, hopefully we'll be able to put together an outline, and then we can look towards the 27th to make sure we have the right factors in place.
I will also note that Facebook has been pretty active, so I also appreciate the viewers that are they're throwing in comments here, and so it's a very important topic, and it's verified by how many are signing in and looking and watching this meeting, and they have some comments as well.
Okay. All right. Well, thank you all very much. Stay strong, stay safe, and stay healthy, please. Thank you. We are adjourned.